Okay, it's recording now. I'm so sorry. Okay, so your name is Laila.
Yeah,
Laila Keshwani?
Yeah.
Okay. So, Laila Keshwani. And so you've been a physician assistant for 13 years?
Yeah.
Okay. And so, how did you land this position of being a physician assistant?
Okay. That's like long time ago. I started as a career to do the prereqs for nursing program.
Okay, yeah, that's what I'm doing now. Nursing program.
I was doing the associate degree for prereqs for nursing. One of my professors, he encouraged me and my friend and told us about this program.
Okay. So where did you attend school?
Dr. Karlberg.
Where?
Dr. Karlberg, one of our professors.
Oh, where is that?
He teaches in New York in one of the community colleges.
Oh, okay.
So he basically encouraged me to do the PA program, and then I changed from nursing to PA.
Okay, nursing. Yeah, that's so. You did the prereqs for nursing, but
I started to, right.
Yeah,
but in the middle of the program, I switched.
So in the middle of the nursing program, you switched.
Uh-huh.
So what did you do at the switch?
I mean, that he encouraged me that it's a different program which will benefit you more, and you are more suitable for this one. And I continued the prereqs and applied for the PA program. Then I got accepted. That's how it started.
So you applied for the PA program where? Sorry.
In one of the colleges of State University in New York.
Okay, yeah. So in an upstate New York community college. So where did you attend college? Or did you, for the nursing program, did you attend like a university before you applied for the PA program in the upstate New York community college?
Yeah, actually downstate New York. Downstate New York, yeah, there was a requirement. There was an associate degree was a requirement to apply for the PA program. Okay, so you were still at the upstate New York community college? No, I was at the community college, called Queensboro Community College, where I graduated, did my associate degree, then I applied for downstate PA program.
Yeah, gotcha. Okay. So, what community college was that? I'm sorry. Queensboro? How do you spell that?
Yeah.
Please.
Queen.
Yes, Queens.
S.
Okay.
Boro, Borough.
Okay. Community college.
Mm-hmm.
Where is that?
That's in New York, yeah.
Oh, also in New York? Okay, great.
Yeah.
I like New York a lot.
Yeah.
So you practice in New York. I would love to practice in New York too. Where do you practice now?
Right, I work in the Wyckoff Heights Medical Center. It's a hospital.
How do you spell?
And I work in a WYCK.
BK?
CC as a cat.
Oh, CK? Wick? O? SS, Wickos.
Yeah, Heights.
Hines?
Heights. Heights.
HEI?
Like
HEI?
CHDS.
Wickos
Heights Medical Center.
Okay. I didn't get the second word. Is it a separate word? Wickos, and then what is the second word?
Height. Yeah, like height at the height.
Oh, height. Wickos Height?
Yeah.
Okay,
yeah.
So it's separate.
Wyckoff Height.
So it's two words, Wickos Height Medical Center?
Yeah.
Okay, yeah. Cool. Thank you. Sorry about that. So what do you enjoy most about being a physician assistant?
Actually, I basically work in the stress lab.
You work in what lab?
Cardiology department. I work in a stress lab.
Chest lab?
Where we do the stress testing, yeah.
Oh, stress testing. Oh, cool. Work in the stress lab. That's a cool. That's a cool. Yeah, I like that.
Yeah. So basically, we have 3 labs in cardiology. One is
you cardiology too? You work in cardiology? That's nice.
Hello?
Oh, do you hear me?
Yes.
Okay, yeah. So you work in cardiology as well?
Cardiology department has 3 labs. One is stress lab.
Yeah.
One is cardiac cath lab.
Cardiac what?
Catheterization.
Cardiac lab?
Yeah, cardiac cath. CATH.
Oh, CATH. Okay. Cardiac cath lab.
And then echo lab.
What's that? Echo lab?
Echocardiogram. Yeah, echo lab. And then we have cardiology clinics.
Cardiac clinics?
Cardiology clinic, yeah.
What clinics? Cardiology clinic. Okay, yeah. Cardiology is, that's interesting. So what do you do for that? Like in the cardiology?
The patient.
You test everybody's hearts?
Sorry?
So you're testing everybody's hearts in the cardiology clinic?
Yeah. Whenever if they have the problems like heart-related problems like high blood pressure, high cholesterol, or chest pain, or any coronary artery disease, they come for routine follow-up in the clinic.
Yeah. So do people come in like if they're having like a heart attack? You know, like do people come in randomly?
Not to the clinic because of course if they have
the clinic is like
go to the ER.
Okay. Yeah, so the clinic is like studying things that people are experiencing, like if, for example.
Yeah, ambulatory.
Yeah, gotcha. Wow. Okay, yeah. The stress lab, that's interesting too. What do you do for that?
So I basically work in stress lab, and when it's not busy or when I'm done, I help in other labs, and mostly I do the clinics.
You said it's not easy?
Sorry?
You said the stress lab is not easy? Is that what you said?
No. It's not busy.
Oh, it's not busy. Okay, yeah. Okay.
If it's not busy, then I help in other labs.
Yeah. Okay. So if it's not busy, you go to gotcha. So the stress lab, cardiac, CATS lab. What?
Mm-hmm.
Okay. And then the eco lab, ECO. Is that what you said?
Yes.
Okay. Yeah. Cool. So the stress lab. What do you do in the stress lab?
Okay, we do the stress testing. Basically, we perform the stress test for the patients who came for testing as an inpatient in the hospital.
Okay. So you just, Okay, so stress testing. So do you work in a team or an independent environment? It sounds like you work in like more of an independent environment.
Actually, it's a team.
It's a team environment. Okay.
Yeah.
Gotcha.
We have like 12 distinct people in the cardiology department.
Yeah.
Including nurses, techs, and PA, doctors, everybody.
Okay, yeah. So it's the cardiology department, basically.
Yeah.
So yeah. How does this style of team environment impact your work? Meaning, like, working with a team can be like challenging, or it can be supportive, helpful, or it can be frustrating working with them.
That's a good question.
Can it be empowering?
I think it's very supportive, and especially there are 3 labs. People are assigned to different labs. So in a sense, if I'm going to stress lab, I'm working there independently. But end of the day, we are working as a team. So I think it's a good environment. It's very supportive. Yeah, so it's supportive, and you'd also say it's like empowering, because it like motivates you. Yeah.
Yeah. Cool.
Mm-hmm.
Yeah. Is there anything that you least like about your job? You don't have to not like anything, if you could be like, oh, it's the best job in the world, But I mean, realistically, there doesn't always have to be the best job in the world. There can be something that you truly enjoy, like you're probably passionate about what you do, but there could be some things that are negative. So is there anything that you do not like,
Yeah, I'm more concerned about the radiation I get while doing the stress lab.
Wait, what?
So, radiation.
Oh, yeah, radiation. You don't like being by the radiation?
Yeah, especially in the stress lab, there's a lot of radiation involved.
Especially the stress lab. Why is there radiation in the stress lab?
Because we give the radiation to the patient, so the whole lab is exposed to radiation.
Yeah, so people, when they get this radiation, are they getting like neurological testing, for their stress?
The patient, they get once in a while. This test not every year, right? More than 5 years. So it doesn't bother them, but we are there to do the testing every day, so it really bothers us.
Yeah, so just to do the testing for stress?
Mm-hmm.
Okay. Yeah.
Okay.
Gotcha. So you give the radiation to the patients. And what was your major in college? Nursing, right? Yeah.
No.
Oh, that was in your major, though? That wasn't?
No, I changed it.
What did you change it to?
To PA.
Oh, okay, so yeah, that was same thing as me, so that's your major in college. Yeah. So, I'm pretty sure you already described your career path to me. That was like how you started off as a nursing major, and then you changed it to a physician assistant, and then you attended, you applied it to the PA program in the upstate. Okay. When did you apply to that? After you graduated, after 2 years?
After associate degree, yeah.
After 2 years?
What is PA?
4?
What was the question?
No, I'm sorry. The question was, when you applied to the physician assistant program in the upstate New York Community College, sorry. After how many years did you apply?
2.5 years of associate degree.
Yeah, after 2.5. So, what was that? Community college called in upstate New York?
It's in downstate, and the name of the college is State University.
What's it called? Can you spell that?
University.
Saint?
Sure. It's usually called SUNY.
Oh, SUNY?
SUNY.
SUNY? SQ?
Yeah.
Oh, SUNY. Okay. SUNY, so
downstate. Downstate. SUNY downstate. That's what it's called.
SUNY what?
SUNY downstate.
Downstate. Okay. Gotcha. So that's basically your career path, right? To your job. So after that, you now work at the Wickhorse Heights Medical Center in New York, right? All right. So that's wonderful. I have to send you. I have to email you actually, if you wouldn't mind sending me your email. I just have to give you a release form, so that you could maybe you could either send me a picture, of it. I don't mind that. Like, you don't even have to, because I can scan it and turn it into my professor. And if you also don't mind, could you send me maybe a picture or something? Anything?
Of my picture?
Yeah. Just just like a profile picture.
Okay, sure.
Yeah. Just